So it's 9 o'clock. So I'm going to go ahead and get started. I imagine that there will be additional people joining us as we move forward. So hello, everyone, and thank you so much for joining us for the Association of Black Cardiologists Community Health Advocate Training Program for Orange County, California. It is my pleasure to work with you over the coming weeks to train you on how to use the Association of Black Cardiologists Community Health Advocate Training Program materials, including the With Every Heartbeat is Life Community Health Worker Manual, to improve the heart health of your community in Orange County. We will be going over ways that you can take the manual that will be provided to you and provide education to your congregation members. I imagine that most of you are with church health ministries, but how to educate them on the risk factors for heart disease and the steps that they can take to make sure that they live a healthy lifestyle so that they can live a longer life and be there for their loved ones. The ABC model is that every child should know their grandparents. But unfortunately, because of heart disease and other risk factors, a lot of individuals don't live long enough to allow their grandchildren to get to know them. But we want to really address this in the Black community and change the narrative. And that's why we are looking forward to working on strategies to improve your heart health. So at this moment, I'm going to take some time to turn it over. I see that Dr. Daphne Ferdinand has joined us from the Association of Black Cardiologists. I hate to put her on the spot, and if she doesn't respond, then we'll move on. But I was going to see if Dr. Daphne Ferdinand wanted to offer some words of welcome. Dr. Ferdinand? It looks like I might have put her on the spot. Maybe she'll come back later to say something. So right now, I would like to introduce one of our sponsors for the program, Adam Porter with Edwards Foundation. Adam?
More than happy to do that. Good evening, everyone. My name is Adam Porter. I work with Edwards Life Sciences organization, and we've been partnering with ABC since 2019 to bring what's called the Spirit of the Heart to Orange County. And that's to help us address health inequities. And the CHAT program is just another evolution of that in terms of getting all of our communities involved. So I'd just like to extend a warm welcome and a thank you to all of you for joining and being committed to address health inequities in our community and educate our communities on heart health and what it means for us. So thank you for being here this evening, and I'll turn it back over to you, Danielle.
Great. Thank you so much for those words, Adam. I gotta figure out how to remove the pen. Okay. So on behalf of ABC, I'd like to welcome you, but I'm gonna turn it over right now to one of my co-workers with the ABC so that she can give a welcome on behalf of ABC and talk a little bit about why we are here tonight. So her name is Miss Nisi Johnson. You will see her on the screen as Lavitha Johnson.
Thank you so much for that, Danielle, and good evening, everyone. And thank you again for your participation and willingness to learn more about the ABC, but more importantly, to advocate more on behalf of the health of your local communities, and especially in Orange County. As Danielle mentioned earlier, we are here to learn together and to share our knowledge and some tools that you can use that you can go back into the community and train them on how to become not only advocates for themselves, but also how to improve their own lifestyles and behaviors as it relates to cardiovascular risk factors and eliminating those risk factors. I will pause, and if Dr. Ferdinand wanted to say something, I would certainly offer that back to her. But while I pull up some slides, and if not, we'll talk a little bit more about the ABC, who we are, and what it is that we do. As soon as I can go back home. Okay, so as Danielle mentioned, my name is Lavather Johnson, but everyone do refer to me as Nisi, so I'm okay with you calling me Nisi. And I am a nurse and an attorney and have been working with the ABC for more than 20 years now in some capacity. My current role is to serve as the senior director for our programs, and we'll talk about a little bit about what the programs actually are within the ABC. Historically speaking, the ABC was founded back in 1974, and it was really an exciting way in which the organization formalized. But in 1974, down in Dallas, Texas, during an American Heart Association meeting, our founder, who was actually from California, LA area, he was listening to all of the epidemiology and the statistics around how people of color were really at the bottom of the totem pole when it came to the health of their heart and how we were at risk as a people more than anybody else that they were talking about doing this educational event for physicians at the American Heart Association. And so part of that, that passion around wanting to serve the community and to do something to change the trajectory of the minority lives and how we were dying prematurely because of things like hypertension and diabetes and other conditions that impact our heart. So Dr. Richard Allen Williams gathered together another 14 group members of cardiologists and said, we need to do something about our community, and hence the way the organization was formalized. So that was back in 1974, almost 50 years ago, and we are still doing what we were founded to do even back then. So we are a member-led organization. Right now we have about 1,300 healthcare professionals that include health advocates for the community, as well as physicians, not just cardiologists, but others as well. And the other exciting thing about the ABC is you don't have to be Black to belong. You just have to have a passion for wanting to look at the heart healthiness of minority communities. Our focus is around eliminating health disparity in cardiovascular disease, and again, especially in people of color. And as Danielle mentioned earlier, our mantra is that children should know their grandparents and become great grandparents with themselves. And as he mentioned, that's because, most grandparents don't live long enough to get to enjoy their grandchildren. And grandchildren even now are at risk for premature deaths as well. So the work that we have been doing for the past almost 50 years is also very important that we continue today. So we appreciate our sponsors like Edwards, who help us to be able to develop programs such as this and bring it to the community. And you'll hear a little bit more about some of the other things that our sponsors are helping us to do as well. But again, our goal is to eliminate health disparities in cardiovascular care, and we look at saving the hearts and minds of a diverse America. So our programs are kind of hinged on 4 different pillars. And behind each one of those pillars is a bit of activity. So number 1 is advocacy. And when we talk about advocacy in this vein, we mean, what do we do as an organization to support those things at the federal level, at the state level, and even at the local grassroots level? We do that through partnerships with other organizations. We have our partners who actually do things with like the Black Caucus at the federal level. We be part of those panels. We're doing things that speak to other type of conditions like smoking, for example. And we'll talk a little bit more about that one in just a little bit. But what are some of those policies? What are those things that we can do that will change person's risk factors or bring a greater awareness to eliminating those risk factors and disparities within our communities? So we do those things at the federal level. We've been doing that since our inception, but we're now really starting to look at how do we turn the corner at the state level and even at the local levels. And some of the work that you'll be doing will actually help us to realize some of that local activity. And then, as I mentioned, we have partners, federal partners and state partners who help us to get the work done. Our other pillar is through education. When we first were founded as an organization, one of the important things that was most important to the membership is, how do we make certain that our physicians, our Black physicians, understand what new technologies are emerging? What are the new guidelines and guidance around, things that will impact their patient's outcome, and making sure that we're engaged in things like clinical trials, things of that nature. So we've put together CME programs. So the ABC is AACME accredited, which means that we have the ability to not only develop the programs, host the programs, but we can also deliver the continuing education for physicians. And as our members are participating in those events, they become the speakers. They also get to attend at no cost. Any member in any of our programs can do that. We also have non-CME educational events, be it things around workforce development, or how do we expand the pipeline and what we're doing, any type of education around that. Just this past week, we had what we call the student retreat, our inaugural student retreat, where we actually brought high school students and undergrads together to talk about medicine and cardiovascular medicine specifically, not only from a bedside perspective, but also from bioengineering and other technologies as well. It was a great event of sharing from mentorship and from some of our historians around cardiovascular wellness, as well as we had an opportunity for them to engage in immersive experiences and do some hands-on technology and device type of things that they were able to do. Excellent event. But the premiere of that particular event is that we had one of our longstanding members who is out of California, who was the first pediatric board certified cardiologist in the United States, Dr. Jones. And we were so excited to have her be with us over this past weekend and really to impart her knowledge and sage into those students who were in attendance. We also have other special projects that are geared towards education that are different than just a community engagement piece, but just focuses on the membership as well as on the professional level. And then research is that third door that we operate in. So research becomes so important for us because we understand as people of color that most medications and devices are made without the inclusion of Black patients or Black, participants or subjects as they may be called. So we want to make sure that we have diversity in clinical trials, not only at the patient level, but also at the investigator level, so that our members and other physicians can be part of the clinical trials and understanding and bringing that information about, that may be missing from a cultural perspective into the clinical trial knowledge as well. We also do impact reporting where we have partners like the National Quality Forum, who actually helps us to look at overall claims data and where are those areas and pockets in the country where we have the greatest risk for premature deaths related to cardiovascular disparity, and what can we do about that? And we provide that information as well. And then the most passionate pillar that we have is our community engagement. Community engagement is so passionate because if we can reach people at their level, at the places where they live and work and play, and make a difference in the behaviors and choices that they make about their own lives, then we really can make all of the rest of the work a lot easier. So, and that's where we are all here tonight, is really part of that community engagement core, where we have our CHAP program, and that's to just say as the Community Advocacy Program. And underneath that, we have chat, which we'll be learning more about tonight. And we have Spirit of the Heart. And Spirit of the Heart is actually a precursor to our chat program, whereby we have leaders in the community to come together at a forum, a dinner forum, and we talk about what are those things that are really impacting this local community and what can we do to make a change. Have a call to action is what we like to call that particular forum. And then after that, we have a health fair, where we want to have a community-wide health fair, take that information that was learned from the forum and then translate it back into the community by doing screening and educational events in the community. And then we have what I really enjoy is what we call our pulpit from the message, health messaging that is being taught in the same week, sometimes on the same day, from ministers in the pulpit who engage with the ABC to make certain that we're getting that heart health messaging out to the congregants, and then asking and charging and empowering the congregants to take that back into the community itself. Other activities we have is Movement with the Mayor, where we engage mayors through our partnerships, as well as Live with the Beat, which is a CDC Foundation program around movement. And you'll get to hear a whole lot about all of those things over the course of the next few weeks as we go through the chat training. Are there any questions about anything I've said so far? Because I've done a lot of talking and I got some more talking to do. So I'm going to pause to see if there are any questions. Okay, I'll keep moving. So this is who our program staff, that's me up there on the far upper left. And Donnell is underneath. You've seen the two of us tonight. Two of our other members who are not on the call is Antoinette. And Antoinette works with us to manage the programs. And you'll get an opportunity to meet her and see her as we continue through the chat program. And Uzuma is our clinical research person and program coordinator, helping out to make certain that all of the data that we're collecting and all of the information that we need, that we're collecting it in such a way that we can report it back out to make sure that we're showing the impact of the work that we're doing, and also making certain that we're meeting certain deliverables of our sponsors. So that's who our internal team is, and we're guided by our membership members who are made up of a committee. So we have a community programs committee that is co-led by Dr. Ferdinand, whom you heard us call on a couple of times, and that committee is responsible for making sure that the direction of what it is we're doing and how we get things done are done appropriately, are timely, and most importantly, that it's well coordinated and in the places that it should go. So we appreciate the direction of our committee, and we just execute what they ask us to do. ABC has a plethora of resources that can be found on our website, anything from our cookbook that we're most proud of, and we also have that in a vegan version now, so look forward to that. 7 Steps to a Healthy Heart is kind of the pillar around how we talk about how do you really get a healthy heart. And there are 7 simple things that we say, if you do these things, that you can certainly ensure that your outcome, your cardiovascular outcomes can be improved. We have a new adult vaccination guide, a guide around clinical trials. And then we have other guides that talks about some of our elderly care and things like PAD. And you'll hear about all of those things as we continue to move forward through this training. So I encourage you to go out to the ABC's website. You can get these digital versions, and as we get to meet one another next month, you'll be able to see some of the hard copies as well. So ABC is here to be able to help you not only through this chat training, but also to make certain that you understand that we are all in this together. And if we're going to eliminate healthcare disparity, it's going to be one person at a time, but collectively we can reach the masses. So we're here to make sure that Orange County moves the needle and having a healthier outcome for the community around cardiovascular wellness. So thank you for that. Donnell, did you want me to talk about anything else right now?
I'll have you back in just a minute, but I just want to go over a couple of things before we have you back. So the first thing I wanted to do is to show you the agenda for tonight's session. Now, everyone should be able to see my screen, hopefully. When I share, sometimes it's hard for me to see my screen. But tonight, so we just had our welcome and introductions. You've heard from Adam Porter. Hopefully tonight, I think most of you may know Pastor Curry. He has another activity that he's part of, but hopefully he'll be able to join us at some point tonight to give us a welcome. If he doesn't, then you'll definitely be able to see him when we have our in-person portion of the training later in November. In just a few minutes, Nisi will come back to you. So she started the introduction of the ABC. She'll come back in just a minute to give you the introduction of the chat. I will then discuss the chat manual that we use, the With Every Heartbeat is Life manual from the NHLBI, and go over how you should use that manual in the community. I'll also go over all the sessions in the With Every Heartbeat is Life manual. I want you to know that for the chat program, we use the With Every Heartbeat is Life manual as the foundation. You know, it has 10 sessions related to cardiovascular disease. But the ABC is a network of cardiologists, and they have other sessions that they like to provide to the community to educate them on, in addition to those 10 sessions in the manual. So we'll be also discussing those additional sessions. Now, the manual, we will teach you the 10 sessions in the manual, and we will also have those sessions from the cardiologist. Some of those sessions we'll teach virtually on this computer platform over the next 3 or 4 weeks. There will be some sessions that we would ask that you do self-directed learning. So we're going to record the cardiologist during the sessions, and then at your time, you can go into the sessions, look at the sessions, answer a few questions on those topics. To complete the training, we will meet in person on November 12th in Orange County to complete the training. And at that time, we will go over the final sessions in the manual, as well as provide you with other resources and educational tools. Next on the agenda, we will have a pre-test after that. And we'll give you about 30 to 45 minutes to take the pre-test. Now, we want you to do this program in your community in a similar fashion that we're going to do it tonight and over the next 3 weeks. Meaning that when you give it out in the community, particularly if you want to record how well you're doing, then we may ask that, hey, do a pre-test before you do your sessions, and then get a post-test. That will give you information on how well you're doing in getting the education and the information out to your community members. That may be a hard task in some cases, but the ABC is willing to work with you on figuring out strategies to allow you to not only do your program, but assess how well the program is being implemented in your community. So tonight we will have a pre-test that we will do. And as I mentioned, we'll give you about 30 to 45 minutes to do that pre-test. I will then go over Zoom etiquette, because as we do these programs, we're going to record. So I hope everyone recognizes that you came into the room, that the session is being recorded. We ask that as you enter, you mute your phones. There will be times when we will ask you questions. You can then unmute your phones to ask the question or answer the question or interact with us. But if you're not speaking, to keep your phones on mute so that we can limit the amount of background noise. But I'll be covering just Zoom etiquette. And then after that, we're going to have our first session of the training, which is Advocacy 101, followed by expectations. So what do we want to get out of this? What do we hope you get out of this? And then how we move forward. I saw that Dr. Ferdinand was on just a few minutes ago. Dr. Ferdinand, if you're still there and you want to say a few words on the behalf of ABC, then I welcome you to do so. She might have stepped away again. I know she's a very busy.
I am serious. Thank you, Dr. Ivy, and also thank you, Nisi. I'm having problems with my computer, unfortunately, and I sincerely apologize for the technology issues that I'm having. Trying to turn on mute has been a challenge. So I just sent the message in the chat to everyone. And I just want to welcome you all. Chat is very dear and near to my heart. And I am so excited that Orange County has decided to become one of our chat program sites. This is an exciting program. The curriculum is excellent. Dr. Ivy has a multitude of experience with teaching this curriculum from the National Heart, Lung, and Blood Institute. And our ABC staff is just tremendous, and we are here to support and help you in every way that we can. So thank you again. I'm not going to take up too much time because I know we have so much important things to discuss and to talk about, especially coming from Dr. Ivy and Nisi. So I just want to say thank you again. I hope to see you all at in other chat venues, and look forward to working with each and every one of you.
Okay, wonderful. Thank you so much for that message. So something happened with my computer and I actually lost the agenda, but I think we covered it all. So next on the agenda, Nisi introduced the ABC. I'll now turn it over to her to introduce the chat program. Nisi?
Okay, so you guys are going to get to hear a lot from me tonight. So exciting, yay. This is going to be really easy. So when we talk about the chat program, What CHAT stands for is an acronym for the Community Health Advocacy Training. So this is a training. It's modeled after a train the trainer. So what we'll be asking you to do, as Donnell mentioned earlier, he'll be using the curriculum to train you, but also he'll be demonstrating how you can also train the community. So it's kind of serving as a dual purpose. So we're going to ask you to have a little bit of a split personality. On one hand, you're going to be learning how to deliver the message, and on the other hand, you're going to be the participant getting the message. So really exciting to be able to do that. When we think about chat, we think about 3 different words. What we really do, and I think these 3 words are really the essence of what advocacy does. We want to advocate, we want to inform, and we want to motivate. So we want to advocate on behalf of ourselves, our family members, and our communities. We want to inform. That's what the education is going to be able to do, is to give you with the tools to be able to inform others about things that they can do to also advocate for themselves, but also behavioral changes. And you'll learn about that. And so motivation is really just that, to motivate people to make a change individually in their households, in their communities, and the people that they care about around them. So that's really what the chat embodies, is advocating, informing, and motivating. So community health advocacy training is what it's all about. So when we think about the chat program, it focuses on 2 things. One, identifying persons like yourselves in the community who have a passion for health advocacy, have a passion to want to see people get better. And then the second thing we want to do is to empower the improvement of that cardiovascular health outcomes, again, of the individual, of the family, and of the community. And when we say family and community, we're not just limited to the household. Those who you care about, that you have as part of your family, that's who we're talking about, that extended people, the cousins, the neighbors, whoever that is. Community the same way. Your community just doesn't have to be the perimeter by which you live. Your community can be your work group. It could be this team of people that you're with now, but we want you to be empowered to be able to help them to improve those health outcomes. And then we're going to give you with the tools and the technical support to make you be successful in that. The training uses the evidence-based manual, has already been mentioned by the NHLBI. It is called With Every Heartbeat is Light. And we really like to use the tagline in this season to make sure that we understand that it is a community health workers manual on heart disease for African Americans. And that's really important because in some areas, there are some state laws that may embody the same root name, but we want to make sure that people understand that we're talking about cardiovascular disease. As I mentioned, it is a train-the-trainer model. It is evidence-based. And actually, Dr. Ferdinand was part of the team who helped look at the curriculum and edit the curriculum in the early 2000s or mid 2000s. And then again, when they revised the version not long ago. So kudos to her for being a part of that team. And I will also say that the ABC back in 2007 was the first community-based organization to be able to actually test the model in the community, where we trained over 250 people back then. So this program has been around for the ABC for quite some time, and we continue to elevate the model and to be able to bring even more people to the program through training such as this. It does engage a local coordinator. And it could be an individual or it could be an organization. And we're still going to try to talk a little bit about the model for Orange County, because it's a little bit different from some of the other city models. Because you guys are representing a group of churches, we need to talk a little bit more with the leadership about how that model is going to really work in terms of that single person to be a local coordinator, and then if we need sub coordinators at the individual churches. It's usually an intensive that takes place over a 3-day weekend. But I talked about earlier, we had to pivot to make sure that we have a virtual program during COVID. So Dr. Ivy was really, really involved and made certain that that pivot happened from that in-person 3-day training to the virtual training. And even now, you guys are going to help us pivot to another level where we are going to have a hybrid, where we're going to do part virtual and we're going to be doing part in person. And that part in person training, as he mentioned earlier, will take place on November the 12th. And it's going to be at Friendship Baptist Church in Yorba Linda with Pastor Curry's church. So the audience that we target for the chat program are lay persons or persons who are non-physicians. So yes, you could be a nurse. Yes, you could, not even have any healthcare experience at all. Wherever you fall on the spectrum, as long as you're not a physician, we want you to be a part of this training. It is shared through the module over a series of training sessions that takes up to about or equates to about 20 hours of learning. So as a learner, we'll be able to help you to understand through each module, a little bit more about cardiovascular health. And then we'll help you to be able to test your knowledge along the way as well. We'll allow a lot of interaction where you get to teach back to us so you can see your great skill sets and use some of the companion tools that come along with the curriculum, including kind of a picture book. So you can use, illustration for how to use those things. I will tell you that Donnell has already given everyone access to the digital curriculum. If you want to follow along with us, you certainly can do that. But when we get together in person, we will make sure that you have a hard copy of your own, of not just the manual, but some of the companion tools that go along with it. And then we want to be able to measure the collaborative work that we're doing. So we want to be able to say, when you go out and do an education, we want to be able to capture that education. And when we can't capture that education, it's hard for us to be able to measure. So we will talk through the evaluation process and data collection processes as we go along throughout the time together. And most of that will happen during our in-person training. So again, when we think about the chat program, there are 3 things that we do. We want to advocate for health for the community, want to inform people about cardiovascular disease and the disparities in healthcare. And then we want to motivate the members of the community to take action themselves to become healthier and change the behaviors of their community. So that's kind of in summary about the chat program. And what it is we do. And again, we're going to dive deeper and deeper into all the elements around that. So thank you very much, and I'll entertain any questions anyone may have.
So if you have questions, please feel free to unmute yourself. As I said earlier, we may have muted you as we were given the talk, but please feel free to unmute yourself and ask any questions you may have.
Yeah, hi, this is Eugenia. I like the idea that you're measuring. Over the 50 years that you referenced, can you just provide some insight as to whether you're showing improvement and what sort of improvement you're seeing? And then just an odd question. I noticed we're mostly women. Is that common in the community outreach?
So I'll take the second question first. Yes. Healthcare, as you know, tend to be, in terms of getting things done at the grassroots level, does engage a lot of women. That isn't to say we don't have males. In fact, in Baltimore, our site coordinator is a male, and he has brought additional males to the table, as well as in Baltimore, we have men. And not only do we just have Black trainees, but we have Asians, Caucasians, and we have some Latinx as well. So there is a mix, but by and large, it is mostly women. So kudos to us girls for getting things done. As it relates to over the course of the almost 50 years of the organization, we have been collecting data around the educational activities that we've done more on the professional level than in the grassroots type of community level. We're just now in the past couple of years starting to formalize how we gather the data, making certain we're doing comparative apples to apples, things of that nature. So we will start to see more about the impact and the reach and what we're actually how we're measuring, what we're measuring, and if that needle is truly moving. I will say on our clinical research side that, yeah, we're still measuring data around that through surveys to understand, what is the engagement of African-American physicians in clinical trials, and what does their patient base look like? So we have done surveys to collect that level of data and starting to report that information out as well. Our greatest area of improvement has to be in our community engagement core, just because we need individuals like you to help us gather the information in a way that is similar so we can do comparative information and share it out. So more to come on that, and we're really starting to dig into getting that data collected even now. So thank you.
Thank you.
So Ms.
And I'll just
Eugenia,
say
I
that,
have a question. I'm sorry, Danielle. I was gonna
No,
ask
go
Ms.
ahead.
Eugenia, are you a person that do data gathering or?
I'm retired now, and but I was a finance manager, and so I was frequently asked to support different programs, and you always ask about data to make sure that you're going to get a return on the work that's being performed in the investment. So
You're
yeah.
absolutely right on that one. Thank you for
Yeah.
that. Thanks for sharing. And so throughout the course of this training, we hope to get to meet the rest of you and understand what everybody does. So Danielle, you were about to say.
Yeah, I was just gonna say, to the second, to your question, so I did work at NHLB, National Heart, Lung, and Blood Institute. So you'll hear NHLBI reference. That stands for the National Heart, Lung, and Blood Institute, which is part of the NIH, the National Institutes of Health. And I did work there in the later 2000s with this program, both with the ABC, but also with the Housing and Urban Development and with other groups. I will say that demonstrating that one program changes behavior is tough to do. However, we have been able to demonstrate within the 2 years that the groups that we have worked with, they've had several activities, several education sessions that they've done in their community around flu vaccinations and flu drives, around healthy eating, around educating individuals how to read food labels. And that's what this program will teach you how to do. We definitely want to figure out how to look at that data, how to measure if what we're doing in the community is having a difference. Sometimes that becomes challenging because there are other factors that are involved. But I would say that working together, we can figure out how to provide that education to the community, make individuals aware of the foods that they're eating, how much salt they're taking in, how much other food nutrients they're getting, and then try to start addressing those healthcare issues. I'll also say that our program hopes to take a step further to look at what are those social determinants of health, those environmental factors that have an impact on individuals' health. Now, those social determinants of health are going to be very different in the communities that we serve. We have this program active in Baltimore, Maryland. We have it active in Jackson, Mississippi. We've been active in New Orleans, Louisiana. Each of those areas have their own different challenges, their own different social determinants of health that have an impact on the health of those individuals. If you look at the news recently, you might see that Jackson, Mississippi just had an issue with the safety of their water. But what we hope to do is say, how do we start really changing the narrative by providing education to the community members? That is going to be where we would ask you to collect data, but the actual change in the community is going to take our program, but also other things that happen as well. But we do look forward to working with you in the weeks and months and years, and hopefully decades to come. Are there any other questions?
Yes, my name is Iris Jackson. I am a lease of medical personnel. I'm a social worker, but I live in Riverside County, and I'm wondering if your organization is partnering currently with organizations out in the Riverside community for this chat, because I'd like to participate at that level, but in the community that I live in.
Yeah, so I will say that we will train all of you, and we want to really expand as far as possible. So if once we train you, if you want to work in a certain area, then yes, we look forward to helping you to figure out how we address that area. Now, the Association of Black Cardiologists, we're a national organization. Nisi is actually in Atlanta, Georgia. I'm in North Carolina. Other staff is in Washington, D.C. So we work at the national level, but we want to work with you and work with Friendship Baptist Church and also the health organization and the health ministries to really do this program. I see that Pastor Curry has joined. I know that he has been leading this effort to really implement this in Orange County. So I'll allow him to say a few words, and then particularly about address how do we make sure that we can expand this program to all of Orange County to help individuals in every area, including the one that you just mentioned. Pastor Curry?
Hey there, I came in the middle, so I'm not sure I heard everything that was said, but good evening to everyone. I apologize for being late, but I had competing meetings today, but we're very excited about the work that we're doing as it relates to health equity and health advocacy. Health equity and health advocacy. We've been working as a collective known as the Health Equity for African American League here in Orange County. And for the last now 5 years, since 2019, my wife and I have had opportunity to work with the Association of Black Cardiologists as well as the Spirit of the Heart event that they've done. So my very first one was 2019 in person, and then we know what 2020 did to us. And so we're excited that we will host the next in-person at Friendship on Thursday, November the 10th, and then the training for chat on Saturday, November 12th, and then health fair on November the 13th. And so I believe that this community health advocacy opportunity will be advantageous for us, not just for Orange County, but for other opportunities that we have. What I appreciate most about what Dr. Ivy has presented for us and to us is that this has the opportunity to help those already in the healthcare profession, but also to help individuals who are just passionate about health advocacy and equity. I'm not a doctor, although my mother thinks I am, but I'm not a physician. But I do believe that it's important that we bring health equity to and advocacy to our various communities, specifically the African American community. We know what the statistics are. We even as we're working on our survey that will come out from HEAL, we have very wide concerns as it relates to many of our people not going to the doctor and not trusting doctors. And so our heart is that this will be a means that we can bring trust or build trust in our community and bring greater health awareness to our various communities. So I'm excited at that level. And as a pastor, leader in Orange County, believe that it is our opportunity. This is our social justice moment. We still have, our concerns as it relates to Black Lives Matters and social injustice in other forms. But I believe that this, our work with health equity and advocacy is needed, and we should partner together, and really appreciate the Association of Black Cardiologists for their work and bringing this opportunity to us, and look forward to what it will mean for us. So I'm an advocate, I'm a partner, and we'll do everything I can to support the efforts as we move forward. And hopefully I covered everything you wanted, Dr. Ivy. If not, prompt me and I'll do whatever else you need me to do.
No, that was wonderful, Pastor Curry. And as you said, I want to re-stress that this is HEAL's program. The church community. This is Orange County's program, and ABC is a partner with you. So we want to work with you so that you can implement the program in the community. But it's going to have to be a partnership where you identify where those needs are locally, where you identify where those resources are to really address that, and then where you go out into the community and provide that education to community members. So we are there to partner with you and work with you. But if you see an area of need, we definitely want to work with you to figure out how to do this. But we want you to see this as a Hill program, Orange County program, a program that ensures that ABC is partnering with you on to move forward.
And
I'll
and
say
if I
one-
can just add one more thing, as the Hill Collective, it is important to us. Right now, we are doing a study. We don't know where our next efforts will be. We may work some area in some implementation. We do have one of our partners who's already been awarded a $500,000 grant to do some work in health implementation and bringing doula to Orange County. Did I say it right, Kalita? And so we're excited. We'll give support to that. This is a new frontier, and Orange County has some resources, and then we're availing ourselves to other resources such as ABC and this chat. So you'll be hearing a lot from Hill soon, and we're very grateful for Kalita Gardner, who is our principal. She leads us and helps to make sure that we implement accordingly. And we appreciate everyone that's a part of this. It's going to take a community effort to make things happen. One of the things that you have to know is African Americans account for about 3% of the population in Orange County. And so that's about 68,000 African Americans. And we are working to put a dent in it. I'll say there's no reason those individuals shouldn't be in our churches, and we should be able to touch them and help them. And then what's not represented in that number that we are going to touch are those African Americans that work and worship in Orange County. There are individuals that work and worship. I've had it happen where I've had a member who was not necessarily a resident in Orange County, but because they worshiped in Orange County and had a medical emergency at church in Orange County, they had to utilize services. Some of our people are in San Bernardino, Riverside, and their doctors actually refer them to doctors in Orange County. And so we want to make sure that we get a good perspective on, and that may answer that other question that I kind of caught the last end of, that we want to be able to serve the population in totality.
Wonderful. Thank you so much, Pastor Curry, for that
No problem.
introduction to Hill, talking about like how we all can work together to really address the needs in Orange County. As Pastor Curry said, we can look at the statistics and see that African Americans disproportionately suffer from heart disease, die early deaths from stroke, have diabetes, and lose limbs as a result of that. So we have to figure out together, working as a team, how to really make sure that we address these providing education. Now, I'm not going to take roll tonight because we're going to do a pre-test in just a few minutes. And I will be able to see who's here based off the pre-test results. So with that, does everyone know how to access their chat box, their chat on the Zoom screen?
Yes.
Yes, okay. If someone doesn't, then please unmute yourself and speak up now, because in just a few minutes, not now, but in just a few minutes, we're going to put a link in the chat, and that's how you're going to take the pre-test. So is there anyone that doesn't know how to use the chat, access the chat box? Okay. Seeing no one, I'm going to first go over the provide.
I
a
don't
little
know
bit
how
of
to use
background.
it. This is Sandra Jones. I don't know how to use it.
You don't. And are you on a computer or iPhone?
I'm on a phone. It's not an iPhone. It's an Android.
It's an Android. Okay. Did you registered for this event?
Yes, I did.
Okay.
Yeah,
'Cause I would just need to
Sandra
find your-
attends Friendship. Sandra, if you touch your screen, do you see a
Yes, I do. It says
an
share.
option for more?
It says share.
No, don't touch that. Just touch the screen and see if you see an icon
More.
that says has ... more.
Yes, I did more.
Okay, press that. Then what do you have underneath there?
Chat, full
There you
screen.
go. So that's how you get to chat.
Okay,
If you press it now, you'll see two messages, one from Daphne and one from Kalita. Daphne, is it, did I say it right? I'm sorry. Pronunciation
Daphne,
is not my spiritual gift.
yes. Daphne, you said it right.
Daphne, okay.
all right,
Do
I
you
got
see
it.
that, Sandra?
Yes, I do.
Okay, so that's how you'll get back to it when he's ready for you.
Okay.
Now, how do I get
and
back from there?
you're
Just press your screen. Press somewhere on the screen.
Okay, I got it. Mm.
All right, there
Okay.
we go.
you're on an iPhone or an Android. What we may need to do is send you an email for you to take the test later. What's your last name?
J-O-N,
Jones, Jones, Sandra Jones.
Azuma, I'm having trouble with getting to my email. Could you send her, Sandra Jones, the link for the pretest? And if not right now, Sandra, we'll get it, make sure we get it to you after the program, because we can do
Thank
the
you.
pretest later as well. But that's how we're going to do attendance tonight. In future sessions, we will need to take attendance. And the way we're going to do that is, I believe, Miss Carlita, you may be, Kalita, I'm sorry. You may be working with us. We may be asking you to help us with taking attendance as we move forward. So as you see names, it'll be just a matter of checking off boxes.
Sounds great.
Okay. So very quickly, I'm going to give you a quick overview of the With Every Heartbeat is Life Community Health Worker Manual from NHLBI. Now I'm going to share my screen, and I've been having some computer issues. So throughout the whole process, I'm going to talk about the manual. Everyone should have, if you registered for the program, you should have gotten a link from me in the email about this meeting today. And that link will take you to the manual that NHLBI has on its website. But here is a copy, electronic version of the manual. I'm sharing my screen now. The With Every Heartbeat is Life manual, which we are going to be discussing in detail as we move forward with the program. Now, the manual, and as I said, this is available electronically, allows you to give education to the community through giving the sessions in the manual. Let me go to what it looks like. And as I said, we're going to cover this in detail as we do the training. But if you were to go into the manual, hold on, give me just 1 second. Got to get back to where I had it. But if you were to go into the manual, you will see that it gives you all of the information you need to say in order to teach community members about cardiovascular disease and its risk factors. So you don't have to improvise and give any information that's not in the manual. We actually ask that you don't do that, because with the manual, it gives you everything you need to say. If you deviate from the manual, then you have to be just cognizant or aware of the information that you're providing to the community members. And if the information is not, accurate, then that can really hurt the efforts that we're trying to do in terms of teaching them individuals about the heart health and how to really do the program. I'm having a few computer issues this morning. That's why tonight. That's why I'm kind of trying to get things moving, but I'm having some issues. So I do apologize. Let me share my screen now. And I was able to pull up the manual. So if you were to go on the computer, you would see the manual here. And the manual has 10 sessions in it that talk about cardiovascular disease. Those sessions include Knowledge is Power, Know Your Risk for Heart Disease, Act in Time for Heart Attack Signs, Get Energized, Say Yes to Physical Activity, Control Your Blood Pressure, keep your cholesterol in check, embrace a healthy weight, protect yourself from diabetes, healthy eating, and other topics that talk about the risk factors of cardiovascular disease. As I was just mentioning, the manual is very comprehensive. So as you look through the manual, it tells you everything you need to know about implementing the manual in the community. It gives you information about each of the sessions. It talks about how to conduct the session. So how to get ready to teach the sessions in your community. It also talks about giving your clothes and then using the picture cards as well. So everything that you will need to get started is in the manual. Now I'm going to scroll down real quickly to session 1, knowledge is power. And this is what we're going to cover in the next session on next Tuesday. Once you go through the manual, as you start looking at it, as I said, it gives you everything that you need to say. So when you give this manual, when you do an education session out in your community, it has exactly everything that you need to say about it. So you'll start by saying, for example, as on the screen right now, heart disease is the #1 cause of death in this country. The National Heart, Lung, and Blood Institute created With Every Heartbeat is Life to help African Americans prevent heart disease. And so everything that you would need to say is in the manual under these terms say. Now, in addition to the script that you see here, I'm going to scroll down. It also gives you handouts to provide in the community. So you'll go through the manual. At the end of each session are your handouts. And the handouts allow you to give information to the community members and allow them to go over the materials with you. As you teach this in the community, you will not give out the manual. So that part that says say this and say it has the script, you won't give that out to community members, but you will give them the handouts. And then as you go through the program, you will refer to the handouts that they can use that really talks about cardiovascular health and how to use it. Now, we have been doing this program for the last 2 years, since 2020, virtually. In that process, we've learned some key things about the best way to do this. And one of the things that we did was we created slides for each of the sessions that helps us to give the sessions virtually. Now, NHLBI didn't create those slides, the ABC created those slides, but we created them for you to use out in the community. The slides mimic everything you need to say in the manual. So they track exactly with the manual. We've created it that way so that if you're doing a virtual session, you can use the slides to do the session virtually. And that's actually what I'll do. So on the next session, I'm going to use the slides that the ABC created to do the program. But we will also give you access to the slides as well. Because as you start doing the program, you may decide, hey, I'm going to do it in person, in which you can do the handouts, or you may decide, hey, I'm going to do it virtually, and then you'll be able to use the slides that we have to do that. Now, the other thing that I just wanted to share with you real quickly, if my computer will let me do this, is the schedule for the training. Give me just 1 second. I just need to pull it up. I may have shared it with everyone. Trying to figure out if I can pull up the schedule. My computer doesn't want to behave tonight. Give me just 1 second. Okay, here. Now, as I mentioned, we're going to do several of the sessions by webinar. We're going to do some sessions that's going to be self-directed learning, and then there will be other sessions that we will do in person. So hopefully you can see my screen, but it's not coming up like I would like. Can anyone see my screen?
Yes.
Yes.
What do you see?
Yes.
So,
To me.
It has a schedule for
agenda.
opening session.
okay, what do you see now? Do you see it should have changed? It says Orange County ABC chat training schedule.
No, it's the
There,
no.
agenda.
Stop
Okay, I'm
sharing.
sorry. Hold on, give me 1 second.
There you go.
Yes, like a spreadsheet with a green highlighted, yellow highlighted.
Yes, yes. So you see that now, right? Okay. So today, today's date is on October 18th. We're starting with the first session, the opening session. We're doing the welcome, introductions, purpose. We'll have the pre-test in just a minute. Then after the pre-test, we're going to have advocacy 101 and then expectations. Next week, we'll start in the manual sessions on earnest. So we'll start with session 1, knowledge is power, and then have session 2. We will then do on November 1st, session 6 and session 3. We then have some self-directed sessions for you to have. And then on November 12th, as it was mentioned, we will have our in-person training at Friendship Baptist Church. And there we will do the rest of the sessions in the manual, as well as have some other education sessions. Okay. Does anyone have any questions about anything we've gone over so far? Please feel free to ask, unmute yourself, let me know if you have any questions or concerns.
Are all the sessions 2 hours?
So most of the sessions, so if you were to do it like in the manual, and I'm not going to do it like in the manual because of time, but if you were to do it like in the manual, each session would probably last 1 hour or more. There are some sessions that if you were to do it correctly in the manual, it could last you 2 hours because, you're giving community members education. You want to give them time to participate. You want to give them time to read, ask questions, and interact. However, as we do the sessions, I'm going to abbreviate some sessions and go through them very quickly. So each of the sessions would last an hour for our purposes. And each of our sessions, our meetings is 2 hours. So it's 2 hours tonight, 2 hours next Tuesday, and then 2 hours on November 1st. I'm going to go through the sessions pretty quickly. I do encourage you as you do it out in the community to think about different ways that you can do it. Now, there are different ways that you can educate the community. So it doesn't always have to be where you're doing an entire session. You can take a handout and read about that handout about, for example, in the next session, Knowledge is Power, we're going to talk about family history, for example. And family history is an important factor of cardiovascular disease. Well, you can just take a handout and explain that to your community members in like 10 to 20 minutes and then give them the handout to talk about family history. You can do that, or, we're going to teach you how to, when you're doing, like, say, there's a health fair in your community, and there might be individuals that are walking around and you're going to take their blood pressure, and how to quickly provide them with education and information about blood pressure. So there you only probably have a few minutes to talk to them about the importance of blood pressure, about what it is, about the importance of getting screened and checked, and then the importance of following up with their doctors. That might be a case where you take information from the manual and you're only using it for 10 minutes. But what we're going to ask you to do is also consider doing full education sessions. So that's where that session that has about the blood pressure in it, well, that's about hypertension, about high blood pressure. It's a session that you can do over an hour and a half because it has a lot of information in it. We're going to ask you to consider how to incorporate education sessions in the community that can last some time. So I hope that answered your question.
Yes, it did.
Okay. Do we have any other questions?
Just,
How do you
are
get
are you going to share that schedule with each of us so we can?
Yes,
plan
I'll
out-
send out the schedule later today.
Oh, that's it.
Or maybe tomorrow to everyone. The schedule is complete. I'll get it to you. Just one thing to keep in mind, that November the 12th session, we haven't fully flushed out the schedule yet for that. So just be aware that we're going to make some adjustments to November 12th. But I'll send out the schedule so that everyone has it.
And the digital manual also?
So I sent an email out to everyone before this, and it had a link to the digital manual. I will send out the link again.
Thank you.
Okay.
Thank you.
I'll send out the link again in another email. Now, there may have been individuals that they're in this session, but they hadn't registered. We ask that if you haven't registered for the session, please go back and make sure that you registered. That does a couple of things. One, it gives us information about who you are, allows us to share that information with Kalita, so that we can really help you as we go through the program. But it also gives us your contact information, your email address, your phone number, so that we can send you information about the sessions as we move forward. So it's very important that if you joined without registering, that you go back and you register so that we have information about you. We can include you in the information that we send out, and we can make sure that we have the information we need to really make sure we get in contact with you.
I have a question.
Yes.
So if I'm not available next Tuesday, is there any way I can see the recording of the session if I'm out of town?
Yes, there is. The one thing we have to think about is how to do that, because what we would need to do is set up a portal that would allow you to go in and view the video. Let us give it some thought. We will work with Kalita to figure out how to make sure that individuals that aren't able to be at a session or so can still view a session and make up. I will say that the ABC's rule has traditionally been that you have to attend 70% of the sessions in person in order to, like, what we call get credit for going through the program. Because there are important things that we do, that we teach you, that help you to implement the program in the community. But we can discuss that with the Orange County leadership, and because we want everyone to get the information. And we understand that people's schedule, particularly as the holidays approach, may be kind of challenging. So if you're not able to do it, we'll figure out a way to record the sessions and allow you to review the sessions later online. We just have to figure out the mechanism for getting that to you.
Yeah, I'm going to try and to attend the session, but just in case I can't get on, I just want to bring that up. So
Yes,
thank you very much.
Yeah, and as you pointed out, we record all of the sessions. So getting those sessions to you, we'll figure out how to do that. And then, of course, we want you to also have access to that so that you can go back, look at for refreshers and so forth.
Hi, Linda Holloway. I have the same issue as Sandra. I'm a healthcare provider, so I'm on call, so I have issues. I may not make every session as well.
Okay. And as I said, we'll try our best to work with you, try to make as many as possible. The reason we say that is because there are certain things, certain techniques and strategies that we give you during the sessions, but we definitely understand that you all are busy professionals. We thank you from the bottom of our hearts for being on this program to learn how to educate your community members about cardiovascular disease. So of course, we want to do everything we can to help make this a enjoyable experience for you as well. Are there any other questions or concerns that I can answer at the moment? Okay, if not, then I am going to ask. I do see one question here. I don't know if I understand it. It says, are any portions of the sessions available for CSUS? I don't know what that is, though.
College credits.
That's CEU.
CEUs. Okay, CEUs. Okay, the way I was looking at it. Okay, at the moment, they're not available for CEUs because in order to get that process, we would have to go through an accrediting organization or accrediting body and then get approval for that for it to be allowed for CEUs. We haven't done that yet. Now, I will say, and I think it was said earlier, that so the community health worker model is a model that is being used more and more in states. And I believe that California, if I'm not mistaken, is one of the states that has reimbursement models for community health workers. So our program, though, the ABC, what we're doing is we're taking the With Every Heartbeat is Life manual, and we're trying to teach individuals in the churches and in other community-based organizations how to use the With Every Heartbeat is Life manual. But we're not an accredited body in terms of giving accreditations to community health workers, to nurses at this time, or to other groups. So even though we will say at the end that, hey, you know, we're going to give you a certificate, that certificate is not the same as an individual that has gone through certain courses to work and to actually charge for reimbursement community health workers. So we don't have the ability to do that at this point in time. We do give you an intense view of cardiovascular disease though. So there's a lot of value in using our manual and our lessons and our educational sessions to really say, hey, I can use these tools to really address cardiovascular disease in the community, to really look at how I can give my community the knowledge that they need and also do outreach activities such as blood pressure screenings in the community. But we are not an accredited body to say that you're a certified community health worker in the sense of what you might hear with some cases in terms of reimbursement. Okay, if there are no other questions, what we will do right now is I'm going to ask Azuma, and I think she's on and she was willing to put the link for the pre-test in the chat. If you will go to the chat, if you have access to it, all you need to do is click on the link that Azuma just put in the chat, and that will take you to the pre-test. I'll ask that everyone right now does that and go through the pre-test. We're going to give you 30 minutes. Now, in your Zoom, if you're on a computer, and I don't know how to do this if you're on the phone, there's a reaction. It says a little button that says reaction. And in that is raise your hands. It says raise hand. Once you finish the pre-test, if you can raise your hands so that we'll know who has finished. If everybody finishes in time, we can go ahead and proceed with the program. But I want to give everybody adequate time to take the pre-test. So at this moment, if you will go into your chat, if you click on the link that was put in the chat by Azuma, then it will take you to the pre-test. And then if you'll go ahead right now and do the pre-test. Does anyone have any questions? Please let me know if you have any problems accessing the pre-test so that we can help you. Our computer person isn't on. I'll try to help you the best I can. I'm kind of limited if you're on a phone. I may not be able to help you. If you're on a computer, I think I can. But if you have any questions about accessing the test, please let me know.
I have a question. This is Lori Sims. I'm driving right now, so I can't access it.
Yes. So what we'll do is we'll make sure that we get an email to you. So Lori Sims, did you register for the course?
Yes, I did.
Okay, so we should have your email. What we'll do is we'll send out the email to the pre-test as well, so that you can take the pre-test if you're not able to access it right now.
No, I can't.
Okay, so we'll send you an email so that you can take it later.
Okay.
We will ask that everybody try to take it before Thursday, if at all possible. I think we have 12 individuals that are finished. Is there anyone still working on it? 13. Okay, now I think we're there. Okay, it looks like we have finished the test from what I can tell. Please,
I have 19 people who've completed.
Okay, great. So I think we've completed the test, so we're gonna move on now to the next part of the program. Everyone can take their hands down now. You can lower your hands as we move forward. So thank you all for completing that pre-test. As I mentioned, we're gonna discuss with you later that as you roll it out in the community, a question was asked earlier about the impact that we're making. And part of getting to that impact may be to do like a pre-test and post-test, which is what we're gonna do. At times that can be challenging because, you know, of schedules, people's time, and so forth. But we want to talk to you as we go along about strategies for making sure you collect data to show that your program is having an impact. But we'll discuss that as we move along. So now I'm going to turn it over to Nisi Johnson, and she's going to give us a presentation on Advocacy 101. Nisi?
Thank you, Donnell. Before I do the presentation on one, I know with this group, we probably want to know how we all fared. But this is just a quick statistics around the test. There were 20 people taking it. The average amount of time was a little over 13 and a half minutes, and the average score was 86%. So what that means is that as you look at this next little graph, that we had 100% of the persons taking the test actually passed. So that's good. That means that you're already halfway to being graduated, and we'll talk about the expectations around graduation as soon as we talk a little bit more about Advocacy 101. So
Hey, Nisi, can you turn
congratulations.
on your camera?
Oh, I don't have a camera on? Well, maybe they don't want to see my face. Okay, there we go. All right, everyone. So this has been a long night and we're in wind down mode. So I am going to try to make this as fun and as engaging as possible. But when we talk about advocacy, and this is baseline advocacy, the first thing we want to talk about, obviously, is what is advocacy? So when you think about what advocacy is, you guys get to talk back to me now. And if you don't talk back, I'm going to call on somebody to talk with me. So somebody tell me, when you think about advocacy, what is it? Or what does it mean to you?
Speaking up for
Another
someone.
person.
Okay, Sandra, thank you so much. Speaking up for someone. And Khalida, what were you about to say?
Actually,
I
I
said-
said the same thing. Speaking up for someone.
Good.
I said representing somebody who could not speak for themselves.
Okay, being a voice for someone who can't speak for themselves. Absolutely. So speaking up not only for others, but also for yourself. Oftentimes, you know, we, especially if we're healthcare givers, we are the last to speak up on our own behalf. But advocacy means not only speaking up for others, but also speaking up for yourself. And so who can advocate?
Anyone.
Anyone can advocate. Doesn't matter how old you are, what credentials you have or don't have, anybody can advocate. And some of our best advocates, if you think about our history, especially of African Americans, those outspoken people were the ones who made change happen, right? So that's advocating, you know, speaking up, don't be shy, and anyone can do it. Thank you for putting that in the chat as well. So when should we advocate?
When we identify a need.
When we identify a need. Anybody else?
All the time.
All the time. We should always be advocating, be it for a need or a want or a desire. We can advocate for those things. Even if it's like, you know, right now, we can advocate on Donnell's behalf because he is actually spending all of his credible time helping us learn. So we may want to advocate that maybe he ought to get a raise or a bonus or something. I'm just saying. We can advocate on his behalf for that. So Donnell, don't believe me, okay? So where can we advocate? Where can we do this?
Everywhere.
Everywhere. See, these are easy answers. Everywhere. You can advocate about anything. You can be, as long as you're being a voice. You can advocate on behalf of anyone, including yourself. You can advocate at any time, and you can advocate everywhere. So how do we do it? How do we advocate? Can somebody give me an example? How do we do that?
We speak up for the homeless. We speak up for abusive relationships.
Yeah, just being that voice, speaking up, or writing a letter. However you can be a voice and amplify the voice of yourself or someone else. That's how we do it. So it can be in written word, it can be in spoken word, even sometimes in songs. You know, some rappers are advocating by the lyrics of their songs, for example. So you can advocate in a number of different ways. And so why is it so important to do that?
You're bringing awareness to a problem.
Yeah, you're amplified, raising up the problem, bringing awareness. And you're not only just bringing awareness, but you also bring awareness to someone who can impact change.
Yes.
Even if that is, I know that there is an issue and we have this government official who may not know about, we don't have sidewalks in our community. So let's all of us get together and be a louder voice. I can be a single voice, but the masses can make change happen too, right?
Mhm.
So when we think about advocacy, I like to think about advocacy in two ways. Either through, when we're talking health, there are those things that we call equality, and then there's equity. When you think about equality, you think about it as sameness. It's the same thing. Everybody is on the same level playing field. Well, with equality, that sameness may not necessarily get us adequate or help us to eliminate healthcare disparity, for example, because it's all the same, but the needs might be different. So when we think about equity, that's more about fairness. And that's really what we're trying to achieve is health equity. So we're not just looking at being equal. Back in the, in the civil rights era, we were really about equality. We wanted to be equal. But now we want to take it to that next step, and we want that fairness to be there. So yeah, you may bend your tray a little extra towards me, but we're making it fair, not just on the same, but we want to have that that fairness, that equity. So if you look at this illustration here on the screen, if you can see that, if you're driving, don't try. But we have these children who are trying to look over a fence at a ball game, and they all are equal with the same box that they're standing on. But when you look at the sizes of the children, there is no fairness because the smallest kid is unable to see, whereas the larger kid is seeing a whole lot more even than the middle child. So when we shift the boxes around and make it more fair, now everybody can take an opportunity to watch that particular ball game. So that's what we're really talking about. We want to see fairness. We want to see equity, not just equality. So when we talk about advocating, we're advocating for equity. Okay, so we want to make sure that we're talking about fairness. I want that homeless person not to just get a meal, but I want them to be able to provide for themselves. So in that case, or they have their own place to live in rather than having to live on the street or in a car. So that is equality if I give everybody a meal, but it's equity if I give him a kitchen to cook it in. Does that make sense?
Yes.
Okay, great. Thank you so much for listening to that one for me. So when we talk about how do we get to that fairness? So we have to think about there are barriers outside of just plain economic barriers, but there are cultural barriers. We know that systemic racism is real. I've been preaching about it for a long time, and now we're starting to realize that, yeah, there are some real systemic racism that's been built into our system of America that really impacts our ability to have health equity. And so in environmental conditions, just, there are some things that where people may live where the air quality is bad, or there are no trees or green space for kids to play, or no sidewalks for people to walk on. So there have these environmental conditions, we have cultural conditions, socioeconomic. Those are the general barriers that we can all see and think of. But then we can squeeze those down to being more social and community barriers as well. For example, a community barrier could be there is no food, we're a food desert. There's no grocery stores, or the grocery stores that we have does not have fresh produce. The produce is the older produce, or the bread is old bread. So there's a community network that becomes a barrier for us to be able to reach this health equity that we're all trying to achieve for. So when you think about, in our own individual lifestyle, in our within our own household, age could be a barrier, gender could be a barrier. There are some constitutional things. Even some of our own personal beliefs can become barriers to us being able to achieve health equity. And so we call these things social determinants of health. So if we're able to change those conditions where people are born, where they grow, they live, they work, or even, the health, there's age as a condition. If we can do something to impact those conditions that will improve or knock down that barrier from them becoming healthy or having healthier lifestyles, then that's what we need to be working towards when we're advocating. So we're looking for, what are the barriers for us, for this community to be healthy? What are they? And then what can we do individually or collectively to address that barrier? So for example, in my own personal story, I live alone. I don't like going to the grocery store. I am not a cook. So guess what I do? I eat out too much, right? Well, I'm creating my own barrier in my own house because I don't want to take the extra steps to be able to cook. So I should be able to advocate for my own self and say, Lisa, you can make better, healthier choices by cooking your own food because you can prepare it the way you ought to do it. So that will help me get towards health equity, but I'm creating that barrier myself. Now that's probably an extreme for some people, but there are real life social determinants of health that are barriers for people when it comes to food, not just food deserts in your community, but also the ability to purchase food. And especially in this economic time, that barrier to purchase good quality food becomes an issue, or even just the knowledge about what is good when we're making food choices. Donnell will take us through some exercises of understanding, not only how to read food labels, but how to choose healthier. Based on, comparing the same thing. A rice is not necessarily a rice if it's packaged differently, for example. And he'll talk to us through some of those things. So we want to address through our advocacy work, what are those social determinants that we can address that are related to cardiovascular disease, and how do we start to chisel away at those barriers so we can achieve that health equity? Remember, our goal is to reduce those health disparities by moving those barriers out the way and improving the health outcome of the community. So some of the advocacy programs I mentioned about the ABC previously, but this is kind of what our advocacy program overarching want to do. We really want to increase the ability to have culturally competent healthcare providers. I talked about making sure that we have a pipeline of continual pipeline of providers. And healthcare providers are not just physicians. That's nurses, that mid-levels, nurse practitioners, PAs, doulas, all of those people who make up the healthcare team. We want to make sure that, one, we have culturally competent people. So when you come to me or I come to you as a patient and I am talking about I need to lose weight, you can't necessarily talk to me if you don't understand my culture and the things that have created these barriers on my behalf. If you understand my culture, and that culture can be a racial culture, it can be a gender culture, it can be a community culture. But once you understand the culture, then you can have a better conversation with me on what I can do to be able to improve my healthcare. So we want to make sure we keep that pipeline of healthcare providers going that are culturally competent. I'm not saying that they all have to be Black, they just have to understand the culture. We want to make sure that we're promoting effective and respectful care. We want to make sure that patients are treated with dignity and respect. I can probably assure you that every healthcare health system has that embedded somewhere into their mission statement or into some of their goals and objectives, that they're going to deliver effective and respectful care. But the reality is, if the people aren't doing it, then it doesn't necessarily happen. We also equal access to medical care. Access to healthcare is very important to the ABC. So a lot of the programs you'll see us talk about and things that we do is around access to care. And we invite you all to certainly listen into our Leaders Forum because we will be talking about access to care even in Orange County, where there are barriers and eliminating those barriers. And also we want to talk about looking at risk reductions. What are those programs to reduce cardiovascular care? I heard somebody on the call say that they were a healthcare provider. Give me an example of one risk reduction activity we can empower people to do to reduce their health risk for cardiovascular adverse outcomes.
They could
Or
exercise.
walking.
Walking, I heard that, walking, and they can access, what was the other one?
I said exercise, so.
Oh, exercise, okay, exercise. So the best form of exercise is walking. Walking can make the hugest difference in anyone's life. And especially now that we are on the flip side of the pandemic, I can tell you during the pandemic was the best thing for my walking lifestyle because I like to walk. My challenge is I don't like to walk alone. My other challenge is that I don't do pets very well. So, you know, where I live, they don't necessarily adhere to leash laws. So I have to choose when I walk just because I'm afraid of dogs, especially. So walking is the best form of exercise. So if we can't do anything else for our community, we can create opportunities for people to walk. Form walking clubs, you know, hold people accountable, do little things that can make a difference. And then, of course, you know, we want to make sure that we're promoting research and providing data because the data is what's going to help people to better understand where they are and to move forward. So our goal at the ABC is zero disparity in cardiovascular disease. And we have an aggressive goal because we want to see that happen by 2030. So you're here to help us reach it. I mentioned earlier that there was one program that we started to do and expanding our community engagement. And it was really trying to take the persons who have been trained through our CHAP program for health advocacy to really start to look at the grassroots policy advocacy. So we did a training this past summer where we invited all of those who have been trained as part of our community health advocacy to go through and really understand how to advocate for the community by engaging policymakers. And you see Dr. Daphne Ferdinand is there. She's the co-chair, as I mentioned earlier. Her counterpart is Dr. Paul Underwood. And then we engaged our ABC policy consultants and strategists to help deliver this program. We must say that it was extremely successful. The outcome was a call to action, and it was very timely because it was during the time where we were trying to advocate on the federal level to get menthol out of cigarettes. And so glad to be able to report that with the efforts not only of the ABC corporately, but also with these individuals who were trained and also, you know, sent letters in and signed petitions, we were able to be a part of a national movement to get the menthol out of cigarettes, and it actually got past this legislation. So kudos to you know, those who were trained and those who were engaged in making sure that that happened. So what's next is that we're looking to do more of those type trainings for those people who are really interested in being grassroots in policy and making change in your community, not just from a health perspective. It can be on any level where gun laws or whatever those things are. But in most instances, most things do impact our overall health. Even, you know, gun and violence, the stress around that and having to live in those environments does take a toll on our cardiovascular wellness. But I won't go down that soapbox. But this is part of the training that we are expanding our advocacy to include policy as well as health advocacy as part of the ABC. So look forward to that. The CHAP program, we kind of already talked about it. That's our health advocacy. And I think in my last slide, I had the wrong one that I displayed. But Jacqueline Ubani and Christopher Batiste are actually the Orange County local members who support the ABC programs and would be a person with whom you can reach out to. And we'll talk more about what to do and how to do with those folks. So now I want to give us a little exercise to do. So one of the things that we did not do when we first opened up was some introduction. So we have about 8 minutes. So that means we got to do this kind of in a round robin real quick. I want you to just give your name, a little bit about your background, you know, if you're whatever your professional, retired accountant or whatever that is, and then give me one thing that you want to advocate for, health related, policy related, whatever that is. It could be for you, it could be for someone else, it could be for your community. And the way we're going to do it is that I'm going to start with the first person I see on my screen, and then that person gets to ask the next person to share. So Miss Jackie Thompson, You're first on my screen. So if you'll go take yourself off mute and tell us a little bit about, other than Jackie Thompson being your name, but a little bit about your background and one thing you want to advocate for.
My name is Jackie Thompson. I am a retired aerospace computer scientist.
Oh.
I have 3 children and 8 grandchildren. I am also, post my retirement, I become a minister, an associate minister at my church. And I work diligently there to get things done. And what I want to advocate for, and I don't know exactly how I want to say it, but since I was growing up, my family has a heart disease that has taken many of our family, and it's something that's hereditary. And I just want to figure out how to make sure we get people to pay attention to what's going on in their families and listen to the information that they get. We found out about the DNA that helped that for our disease, but I couldn't even get my own kids to be interested in that.
So is that
Still need
ATTR
to work
with cardiomyopathy with ATTR? We can talk about it later.
Yeah, it is. I think I have to think. Yeah.
I have some information we'll share with you so you can share it with your family.
Okay. Wonderful.
Awesome. So who would you like to say to call on to go next?
Let's see, Linda Holloway.
Hi, Linda Holloway, registered nurse. I work in GI, but I've worked in ICU back in Philadelphia, but of course, I work here in GI in Orange County. I'm just really interested in helping everyone to take control of their health through eating healthy and exercising. So we do a little bit at church with walk club and a 5K before the church picnic and just different things throughout the year. So
awesome. And who would you like to go next?
Joyce Moore.
Okay, Ms. Moore.
I knew she was going to do that. I go to church with Linda, and I'm presently kind of moving into retirement. I worked the last 21 years for the state of California at a regulatory agency. I'm an RN there, and I too want to advocate more for healthier eating because for me, that's kind of like been my whole lifestyle, especially since my kids have all left home and, eating by yourself, grabbing something quick, like I think you said earlier. And I could cook, and I am doing more since I'm at home a little bit more. So that's working out, and I am riding my bike more.
Awesome.
And I'm going to choose Sandra Jones.
Okay, Ms.
I knew she was going to do that. My name is Sandra Jones. I'm a registered nurse. I'm a retired registered OR nurse of 37 years, and I love my job. I'm going to advocate for, I am an advocate. I joined the Donate Life program. My husband just died recently of kidney failure, and he was on dialysis for 17 years. So I became involved with Donate Life, and I went through the program and become an advocate for Donate Life.
Awesome. And who would you like to call on?
Iris.
Ms.
I knew you were going to do that, Sandra Jones. My name is Iris Jackson. I'm a retired part-time, currently working social worker. I want to advocate for, I have numerous family members who have diabetes, heart disease, and just a plethora of health issues. And then I've been recently introduced in my community to various organizations, nonprofit and otherwise, that are dealing with seniors of color, and a lot of the health issues that surround this. So when I saw this link come up, I thought, yes, this is perfect. I want to gain as much knowledge and information as I can to share with those who I'm getting connected with in my community.
Okay, and who would you like to call on next?
Let's see here. Jackie Thompson. I don't have the full view on. So
Yeah, Jackie went first, so
okay, let me.
how about Karen Hurd?
Let's do that. Karen, we're calling on you.
You're on mute if you can hear us, Karen.
Yeah, hold on one second. Okay, so I just got home. I was running late. I decided to do this because this is something that I like. I like teaching, and I'm a registered nurse at Kaiser Permanente. I work in ambulatory care, teaching hypertension. So it'd be nice to teach it differently in the community, or just in the community, because I teach Kaiser. Now I want to teach outside of Kaiser. So I found this to be an opportunity for that.
Awesome.
All right.
Can you throw the ball over to someone?
Yes. Hold on. Let me figure out how to switch it back.
Well, just call a name. That's
to the list. I know I had to find the list though.
Ah.
Beverly Atkins Hall.
Hi, I'm Beverly Atkins Hall. I just retired in November of 2021 as a registered nurse in surgery. I had a lot of family members who have congestive heart failure, a lot of heart problems going on. My dad had died of heart disease. His father died at 57 of heart disease. I have a lot of family members who is dealing with that now. And I was, happy to retire, glad I'm not on the clock anymore, but I just want to give back to the community. And Friendship Baptist Church sent me the link on the phone, and I just wanted to see what it's about. How can I help out? I don't know about, how I'm going about it. I like to be involved and just get in the community and promote, healthier living. So this is something I am interested in, and hopefully I can get some help to do it correctly for the community.
Awesome.
That's about
I
it.
am in trouble because it's at the top of the hour, and Donnell is going to get me if I don't ask for your permission to continue having you introduce yourselves, or we can pick it up at the beginning of next Tuesday session. So it's up to you guys if you want to continue.
Next Tuesday.
I'm sorry, Nick. Oh, Sandra said she's ready to call it a night.
Yeah, my vote's next Tuesday as well.
Okay, all right. So we will continue. So you think about it, and what we'll do next week is that when you come on the call, we'll see if we can get through it quicker. I made notes, so for those of you who have already participated, thank you so much for sharing. Certainly, thank you for sharing your passions. When we talk about, expectations and what's next, the expectation is that you need to make sure that you get 70% of the training done. You have to achieve 70% on the exam, which we all did that successfully today. And then, and that's the final exam that we'll take on the 12th of November. And then we expect that you do at least one education in the community per month over the course of 12 months. And then 2 activities. And you all have an opportunity to get your first activity in on the 13th, because we'll be having a health fair at the churches. And so we'll talk more about what that looks like, and we'll talk more about those expectations on next Tuesday. So I'm going to stop talking. I'll turn it over to Donnell for any final remarks. So
yeah, I just want to say thank you everyone for joining tonight. Giving 2 hours of your time, and then over the next couple of weeks, we'll learn how to use the manual to really address those cardiovascular health issues in the community. Thank you so much for attending. We will be sending out the test link to individuals so that you can take it. We'll also try to determine what the best strategy is to record the videos and get them to you so you can watch them if you miss a session. Thank you, everyone, and I look forward to working with you again next week. So next Tuesday at 6:00 p.m. Pacific time. It's 9:00 p.m. Eastern. I'll see you then. Have a nice night, everyone.
Thank you. And don't forget to send the link for the manual, please.
Oh, yes. I'll make sure we get that out. Good night, everyone.
Good
Good night.
Good night.